Right now, behind the retina at the back of your eye, there is a piece of your circulatory system about the size of a fingernail. Every year after 60, it has been quietly recording the exact same damage your heart's arteries are taking. Almost nobody has been reading the recording. For the first time in modern medicine, an artificial intelligence scan can read it. What it is finding has stopped cardiologists in their tracks. There are 4 warning signs in your eyes. 4. By the end of this video, you will know which one your doctor probably has not even been trained to look for yet. By the time we get to the 4th sign, you will know which is the one cardiologists are now calling the silent predictor, and why most eye doctors have not been told to flag it. You are also going to ask the same question I asked the first time I read this research. How on earth can a picture of your eye predict what your heart is going to do? I will answer that in 2 minutes flat. I am Dr. Richard James. For more than 30 years, I have watched the line between the heart and the eyes get blurrier with every new piece of research. In the last 18 months, that line has finally disappeared. In the next few minutes, I am going to walk you through the 4 warning signs your eyes have probably already been showing. I am also going to give you the one specific scan request to make at your next appointment that puts AI-driven retinal age gap analysis to work for your heart. The retinal microvasculature is the only place in the human body where doctors can directly see arteries without cutting. For decades, ophthalmologists logged what they saw: narrowing, crossings, tiny microbleeds. But the heart and eye worlds rarely talked. Cardiologists worked from chest pain. Ophthalmologists worked from vision. The small vessels behind the retina, which respond to the same forces as your coronary arteries, sat silent in chart notes nobody ever read aloud to you. In 2024 and 2025, AI models trained on millions of retinal images began outputting a single number: the retinal age gap. How much older your retinal vessels look than your chronological age. A 67-year-old whose retina reads as 80 carries cardiovascular risk that no standard 10-year calculator captures. This is not a normal part of aging. By the time most patients notice the first sign, a meaningful share of the underlying vessel damage is already in motion. Here is the answer to the question you started asking 90 seconds ago. Your retina and your coronary arteries share the same wall structure, the same response to inflammation, the same vulnerability to high blood pressure. When one ages on a 30-year clock, so does the other. The retina just happens to be the only one a camera can photograph in 60 seconds. Let me give you a profile that walks the next 18 minutes with us. Imagine a patient I will call Rachel, the kind of profile we see in clinic every week. Rachel is 70, a retired English literature professor, married 47 years, 2 sons, 4 grandchildren. She came in for a routine eye exam last winter, mostly because her glasses were a year overdue and the light in the late afternoon felt slightly off when she was reading. Her standard blood pressure was in range. Her cholesterol panel was in range. Her 10-year cardiac risk score had been called low by her primary care doctor for as long as she could remember. Her retinal scan came back with an age gap of +11, 11 years older than the rest of her body. We did not change a single medication that day. We changed the conversation she was having with her cardiologist for the next 6 months. Sign number 1 is the afternoon. The light feels slightly off. Colors are slightly less crisp at 4 in the afternoon than they were at breakfast. You blink, you adjust the lamp, you keep going. Most people over 60 have noticed this drift for at least the last year. Almost nobody has been told what it means. That mild loss of contrast late in the day is one of the very first signals that the small vessels in your retina are losing some of their oxygen delivery as the day's metabolic demand stacks up. The retina is one of the most metabolically active tissues in the entire body, gram for gram. When the microvasculature stiffens on a 30-year curve, the first thing to slip is not your central vision. It is the fine edge work your eye does in mid-afternoon light. Some of you are listening to this and quietly counting the times this happened in the last month. The brief flicker on Tuesday afternoon when the kitchen suddenly looked slightly hazy. The half-second softness of an edge while you were folding laundry on Thursday. The moment you assumed was simply tired eyes after dinner on Sunday. None of those moments are meaningless. Each of them is data. And every one of them is the kind of data the AI retinal scan was built to take seriously. Sign number 2 is the brief blur. It comes. You blink twice. It clears. You shrug. You tell yourself you are tired. Most people over 60 have done this dozens of times in the last year and not mentioned it to anyone. Not their spouse, not their primary care doctor, not their eye doctor. What is actually happening is brief microvascular ischemia. A small region of your retina is, for a moment, getting a little less perfusion than it needs. The brain compensates almost instantly. The episode resolves, and the chart never logs it because you never report it. The reason almost nobody connects either of these to the heart is that, for 40 years, no one told us they had to. The retina was the eye doctor's territory. The heart was the cardiologist's territory. The blood vessels in between were nobody's. That is the gap closing this decade. Now here is where it gets really interesting. The next sign is one your eye doctor has actually been writing in your chart for years, without ever connecting it to your heart. Sign number 3 has a name almost nobody outside of ophthalmology has ever heard. It is called arteriovenous nicking, AV nicking for short, and it has almost certainly been written in your eye exam chart at least once. What it is simple. A tiny artery in your retina has stiffened and hardened to the point that, where it crosses one of your retinal veins, it physically compresses the vein. The vein looks pinched. Your eye doctor sees it on a dilated exam. They write down the words. And almost no one has ever told you that what they just logged is a marker of long-standing vascular stress that does not stop at the eye. By the time AV nicking shows up in your chart, the same biological process is statistically very likely to be happening in coronary arteries you cannot see. Large prospective cohort studies, including the Atherosclerosis Risk and Community Study and follow-up imaging research published over the last decade, have linked retinal AV nicking and arteriolar narrowing to a meaningfully higher risk of incident stroke and cardiovascular events in adults over 60. This is the part most doctors do not take the time to explain. AV nicking does not mean you are about to have a heart attack tonight. It means your blood vessels, the ones you cannot watch, have been telling the same story your eyes have been showing for years. The only person reading the eye story has been your eye doctor. Now, this next sign is the one I lose the most sleep over. It is the one that even most cardiologists are still learning to ask about, and it is the most important sentence in this entire video. Sign number 4 is not a feeling. It is not a finding. It is a number, and it is the most important number we have for cardiovascular risk after 60 that almost no one is being given. In the last 2 years, AI models trained on millions of retinal photographs have learned to predict, from a single picture of your eye, how old your blood vessels actually are. Not your chronological age, their age. The gap between that number and your real age is called the retinal age gap. A retinal age gap of +10 has been associated, in published prospective datasets, with a substantially higher risk of heart attack and stroke in the next decade than any standard cholesterol panel will tell you. The scan that produces it takes under a minute. There is no needle, no fasting, no exercise treadmill. A camera takes a picture of the back of your eye. The picture is sent to an AI model, and a number comes back, your retinal age. The difference from your chronological age is the lever the cardiologist of 2026 is starting to use the way previous generations used cholesterol. Think about what this means for the rest of medicine. The eyes have always been described as the windows to the soul. It turns out they are also the only window we have, in real time, into your blood vessels. The AI is finally fluent in that language. Here is what most people do not know about how this number is built. The model is not guessing. It is reading details a human eye genuinely cannot see at standard exam magnification. Subtle changes in the diameter ratio of arterioles to venules, the texture of the wall of a single vessel, the pattern of branching at a particular intersection. Patterns that, when held up against the data of millions of people whose 5-year and 10-year cardiovascular outcomes are already known, predict your trajectory with an accuracy the older calculators were never designed to reach. A retinal age gap of +5 is meaningful. +8 is significant. +10 is the kind of result that, if I see it on a retired school teacher who feels perfectly fine, completely changes the cadence of how often I want to see her, what I want her cardiologist to run, and what I want her doing on her own at home over the next 12 months. without changing a single medication. So here is exactly what I want you to do. Starting at your very next eye appointment, there is one specific request that turns all 4 of these signs into a single number, and I will give it to you in a moment. Now I know what some of you are thinking. Your eye doctor and your cardiologist have never mentioned any of this. If it were really this important, would you not have heard about it by now? You are right to question it. The honest answer is that the technology has arrived faster than the guidelines. Retinal AI scans are clinical, not theoretical. The published research is real, but they are not yet in standard cardiology workflows. This is the gap between when the science arrives and when the system catches up. And that gap is exactly where you, the patient, can step in with a single question. Even without an AI scan, you can ask your eye doctor to read aloud the chart notes from your last 2 exams. AV nicking, vessel narrowing, and any small hemorrhages will be logged there. Most patients have never asked, and almost every patient over 60 finds at least one item they were never told about. The conversation needs to happen. Here is how that played out for Rachel. After Rachel asked her cardiologist about her retinal age gap, her care plan did not change overnight. What changed was the frequency of her follow-ups. A stress test that was originally scheduled for the following year happened in 2 weeks. That stress test caught a finding that, on her old timeline, would have been picked up in an emergency room a year later. She did not get a new diagnosis. She got a new clock. That is the entire point of this video. You may not get a new diagnosis from a retinal scan. You will get a new clock. And on a 30-year horizon, the clock is what saves lives. Here is exactly what I want you to do. Starting tonight. Tonight, write down which of the 4 signs you have personally noticed in the last 90 days. Afternoon contrast loss. Brief blur episodes that resolve on their own. Anything from past eye exam chart notes you can remember being told. And the date of your last eye exam. Be honest with yourself about all 4. That list is the most important page in your medical file you will ever produce on your own. This week, call your eye doctor's office and ask whether your most recent exam logged any arteriovenous nicking or vessel narrowing. Most offices will read the relevant chart line aloud over the phone if you ask politely. You do not need a copy of the full file. You need 2 sentences. At your next appointment, you do not need a debate. You need 1 sentence. Write it down. Take it with you. Do you offer retinal age gap analysis? And if not, can you tell me which clinic in this area does? Some of you are going to feel awkward asking that. I want you to ask anyway. The point is not to challenge your eye doctor. The point is to put a tool that exists onto the same desk as the test results that have been guiding your care for the last 10 years. If your clinic does not yet offer the scan, the answer of where to go for one in your area is, by itself, the second most useful thing you can walk out of that appointment with this year. That single sentence is the bridge between the standard eye exam checklist your last 60 years of healthcare were built on and the technology that is already changing how we predict heart attacks in 2026. Your eyes have been telling the truth on a 30-year clock. For too long, we have only been listening to the things they could put on an eyeglass prescription. Now you know how to listen to the rest. If anyone in your life is over 60 and gets eye exams without ever being told what was found, share this video with them tonight. Share it with your spouse, with your sister, with your father. You might never know it, but you could be the reason someone you love asks the right question at the right appointment. Next, I am going to walk you through the statin side effect myth and the new Lancet data showing why stopping a statin prematurely may carry more stroke risk than the side effects most patients are afraid of. Stay close. Take care of your heart tonight. Take care of your eyes tonight. I am Dr. Richard James, and I am rooting for you every single step of the way.